Basically, commonly known as Tylenol during pregnancy can be associated with a very increased risk of autism.
U.S. President Donald Trump said at a news conference pregnant women should avoid Tylenol.
So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that.
Dr. Janine Hodson, a maternal fetal medicine specialist at London Health Science Center, points out a large recent study of more than 2 million pregnancies.
So there's no good studies that link it, and there's actually a recent study that came out just last year, and it had over 2 million pregnancies, and they prospectively looked at acetaminophen exposure. And when they adjusted for siblings, there was no association with autism. And so that's a pretty high quality for pregnancy study. And so really the data overall, I don't think shows a good causation.
For women worried about Tylenol, Hudson said the first step is to seek medical advice.
Talk to your healthcare provider. And, there are other options potentially if it's a different type of pain. So if it's chronic pain, neuropathic pain, there might be a better option for long-term use. So definitely talk to your healthcare provider. But for instance, if you have fever in the pregnancy, and you need Tylenol or acetaminophen for the day, fever can lead to problems in the pregnancy like miscarriage, neural tube defects. So the very minimal association, if anything, with autism for, a dose or two would definitely be more beneficial in that situation. And so, it shouldn't be a yes or no answer. It needs to be a discussion.
Melissa Renou, XFM News.